take a break from that and just tell you a little bit of history. One thing I want you to remember is that the history of the treatment of pituitary tumors is really commingled with the history of neurosurgery itself. And both are very young in the context of surgery as a specialty. And so the action in terms of the origin of neurosurgery and the origin of transsphenoidal surgery for pituitary tumors was really in the early 1900s, so just over a century ago. Schlöfer was at Innsbruck, and he was the first person who successfully removed a pituitary tumor via transsphenoidal. And when I say transsphenoidal, that means through the nose. All right, and many of you have seen this model, and this is the same as looking the same way as we did with a section through the human head on the screen. So that's looking from the front, and then look from the side. And so this would be a transsphenoidal, or going through the nose to get to the area of the pituitary gland, which sits right here in this sella turcica. All right? And so up until, I should just backtrack a little bit. Up until that time, in the previous few decades, there had been people, surgeons, who had gone in from above, from taking a piece of bone off the head, take a piece of bone off the head, lift up the lobes of the brain, and then slide in under here and try to remove the tumor that way. The mortality before transsphenoidal surgery came for that kind of procedure was 30 to 40%. In other words, 3 or 4 out of everyone operated on died. And the ones that survived didn't do that well. So this other approach was proposed, and it was based on some anatomical investigations from Venice. And this became a possible way to operate. Now, these are actually some of Schlöfer's original drawings of the technique that was used. And I don't want you to focus on any of the details, but one thing to keep in mind is you can see the incision here. So an incision went from the middle of the forehead and then down around the nose and around the bottom of the nose. And essentially, the nose was moved off to the side. And then the surgery was done after the nose was hinged off to the right side in this case, and then sutured back at the end of it. Well, a number of things happened after Schlöfer. Kocher improved visualization, and visualization was really a big issue because you're trying to get to a tiny spot at the end of a long surgical corridor. And both Kocher and then Halsted proposed different techniques which essentially did not require removal of the nose, but instead dissected the mucosa off the middle of the nose. And the one that Halsted proposed was one that actually has been used for many years, even up until the last decade or so. And that was to make an incision above the teeth, in the gingiva of the gums, and then to go up underneath the mucosa to get to the back part of the nasal cavities. Now, I really want to focus our attention on Harvey Cushing. Harvey Cushing is the father of neurosurgery as a specialty. He's the first person ever to do solely neurosurgery as a specialty. He was actually trained by Halsted, who was at Johns Hopkins University. And then Harvey Cushing did most of his surgery in Boston at Harvard. And in 1909, Cushing did his first transsphenoidal surgery. And within about 3 years, he had perfected what became known as the Cushing transsphenoidal surgical procedure. And he took various aspects of what people were doing, and because his influence was so powerful, what he ended up doing became what was kind of accepted as a standard. Now, the first transsphenoidal surgery, this is Dr. Cushing at his desk at the Brigham's Hospital in Boston. This is a picture of me from about a month ago, and it says something about Dr. Cushing as a surgeon and as a tour de force in terms of his personality and what he actually did. This is a library to his name at Yale, and I was visiting there a month or so ago, and they discovered at Yale that there was a collection of specimens from Dr. Cushing that had been given to Yale by Cushing and had been essentially neglected for many years in the basement of this building. And someone who was looking up the history discovered this collection, and then the neurosurgical community provided funds to create this library. And if you ever have a chance to visit this, it's worth a visit. But essentially, all around this area in the basement are these specimens in jars. There are hundreds of these, of all his, not all, of many of his patients who had surgery and then went on to donate their brain in an effort to better understand the reasons why certain procedures were successful and why certain ones were not. So very significant contribution to our understanding of neurosurgery. And if you go there, the main poster for the entrance into the library, as you can see, this is Dr. Cushing in his later years, and this is a patient with gigantism that is part of the display. This was actually a picture of Dr. Cushing's first transsphenoidal surgery patient that he operated on. And this was a picture of the patient many years before Dr. Cushing had seen him. And then this was a picture of him when he was operated on. And you can see the development of many of the facial and hand features of acromegaly. When we think of technology, this was the technology that Dr. Cushing had at his disposal at that time. And that was a plain X-ray of the skull. And you can, with that plain X-ray, he could detect that there was a little change in the bony structure, and that led him to operate. And this is the same patient after surgery. This is 2 weeks after surgery. And this is 3 months after surgery. One thing you can notice in terms of the scar here, you can see that kind of a variation on that theme that we just talked about. And also you can see that, again, there was some regression or diminishing of some of the soft tissue features of this patient even by 3 months after surgery. Remember, this was at a time when still many things about pituitary function were not well understood. It was not understood whether this condition resulted from excess hormone or turning off of a hormone, for example. And so quite an accomplishment at this stage. Remember, I said the mortality of surgery up until that time with a transcranial approach was in the 30 to 40% range. Dr. Cushing performed in 15 years 241 transsphenoidal surgeries with an impressive mortality rate of 4.6%. Okay, there's a tremendous move forward in terms of providing surgical treatment with a remarkable change in the mortality or death rate of patients. These are pictures from Dr. Cushing's surgery workbook, and you can see This is Dr. Cushing, and the light here is essentially like a flashlight taped to his head, trying to look down and make his way into the area of the pituitary tumor. And this is later in his career where he adopted this incision above the teeth as a way to get to the pituitary. You also notice this instrument. There's a nasal speculum used to just create a space for down the nose, and we still have these in our hospital, and they are used to provide a corridor down the nose to get to the base of the skull where the pituitary tumor is. Now, Dr. Cushing was tremendously influential in terms of neurosurgery, and what he did had a tremendous influence on what others did. What he didn't do had a tremendous influence on what others didn't do. As he became older and gained more experience with this, he also became more familiar with transcranial approaches, and he ultimately abandoned this procedure because he felt that the transcranial approach was probably a better approach for many of the patients that he had to treat. And when he stopped doing it, virtually everyone else in the Western world stopped doing it, except this gentleman, Norman Dott. And he was from Edinburgh. And Norman Dott had come to Boston, had learned the technique from Dr. Cushing, and he kept doing this in Scotland because he felt that this was a very good surgical procedure. So he was the only one doing this. Then this chap, Guillot, who was from Paris, came over to Edinburgh, and he learned the procedure from Dott. And Guillot was a very active surgeon and performed over 1,000 of these surgeries, and really kept it alive. And here's a Canadian connection. This gentleman, Dr. Jules Hardy, he was from Montreal, still is from Montreal, still alive. He went to Paris and learned the technique from Guillot. And he brought that back to Montreal and then to the world by introducing many things, innovative things, including the use of the microscope, which was a major advance in terms of visualization around the surgical area. So just to show you how young the surgical specialty is of neurosurgery, we've gone from Cushing to Dott to Guillot to Hardy, and here's a pamphlet about Hardy that I received from Jules Hardy. I trained in Montreal, and I actually worked with Hardy doing transsphenoidal surgery. And he has a little inscription here to say, you know, to me for help with the procedure that we were doing at the time. But it just goes to show how young neurosurgery is as a specialty.